Up to.
All right.
Yeah. Okay.
Here we go.
Okay.
Here we go.
Yeah.
I'm here with Professor Yifei Sun, who joins us from LA, correct?
Yes. Northridge, part
Welcome,
of area.
Northridge. Well, I'll let you introduce yourself, and then we'll talk a bit about the situation in China, about coronavirus, and whatever you can help us with.
Sure. So you already know my name's Yifei Sun, and originally I was born in China. I grew up in China, and then came to the state in 1995, and then went to University of Akron for geography, as human geography, particularly economic geography, and then went to SUNY Buffalo, State University of Buffalo, and finished my PhD there. And particularly at that time, I was working on something called a geographic information system, spatial statistics, and urban and regional analysis. So combine the technology and the subject on urban and regional. And then I joined the Cal State Northridge in 2000 and started as a faculty member in the geography department, teaching GIS, spatial statistics in China, urban geography, economic geography, those classes. So far has been working here for almost 20 years. So 19 years. It's a 20th year. Yeah. Good enough?
And you're good enough. And you like LA, I suppose.
Oh yeah, it's gorgeous now. It's just like your area. Your area is not bad at all. It's like I think now it's 75 degrees sunshine and not so much smog.
We don't want to hear from that. We are here in the humidity of northern Italy. Okay, let's let me ask you. So one main concern is what I understand you're just back from a long trip in China, right?
Yeah.
You visited a number of cities. Can you give us some very brief? I mean, just stick to number situation, a few words. The situation as you perceive it in the Hubei province and in the city of Wuhan?
Hubei, I did not go to Hubei, first of all. It's too scary for me, to be honest. And I did not plan to visit that city either. So I went to China on January 1st, the New Year day, and stayed there for almost a month. I just came back Tuesday last week. So today is Tuesday. So exactly 1 week ago. So it was an interesting trip. To begin with, I stayed in Beijing, Tsinghua University for like 10 days, visiting my friend in Beijing. And then went to northeast China, Changchun, which is the capital for Jilin province. And then went to Shenyang, which is the capital of Liaoning, two major provinces in the northeast China. And I came back to Beijing and then took the train to Nanjing, which is a city on the Yangtze River, about 1 hour away from China.
Yeah, for the sake of saying, so can you then do you have any idea what the correct situation currently is in Wuhan?
It's a mess. It's a mess.
That we have no doubt. So let me be more specific. One thing everybody obviously is concerned is the following. If one looks at the official statistics, it's a bad situation, but it's not terrible. In particular, the number of cases is not yet reached 20,000, and the number of dead people is, I mean, I don't want to sound cynic, or callous, but it's relatively small compared to what the tragedy one was expecting. In particular, the mortality rate reported is different. It's very different between Hubei province, Wuhan, and the rest of China. What can you tell us about that? Do you have any evidence of how reliable those numbers can be, or if they are due? The general theory is the following, which seems credible. Numbers are low because testing kits are in short supply. And to the extent the testing kits are short supply, it's the testing kits that determine the number of cases of infected people and not, that doesn't really report the true number of cases. What's your perception?
I think that kind of report or perception is true. It's already reported by Chinese reporters.
Yes, I've seen that in China. But this would be true in Wuhan. It's hardly the case in the rest of China.
It's true in Wuhan. I think it's untrue in other places because Wuhan right now is a mess. I say everything is in shortage in terms of beds, in terms of testing kits, in terms of masks, in terms everything. Okay, everything is in shortage. It's a crisis mode. But in the rest of the China, it's different because all the places they have mobile up and got the supplies in place. And those people who are affected or have the potential to be the carrier of the virus, they're quarantined. So there is enough supply for them to take care of the current patients or potential patients. So it's not the issue. So for those provinces, particularly for example, right now you have major problem in Zhejiang province. You have major problem in Guangdong province.
Guangdong,
and those provinces, those provinces happen to
be
for
those that don't know the geography of China, maybe I should say Guangdong is a province to the south of China. And it's a very industrialized province.
Yes.
It's probably, well, I don't want to start doing ranking, but it's certainly one of the most industrialized.
It's the largest one. It's the largest economy in China.
Yeah, it's in some sense the epicenter of, excuse me, where the growth started 40 years ago. And but in Guangdong, for example, we have, according to the Johns Hopkins Center, 725 cases and 0 deaths. And so the question is, in Guangdong, there is probably, so is Guangdong also in short supply of testing devices, and therefore this number is determined by that, or is that you think a reliable number?
It's a reliable number because right now, the only reason for anybody dare to lie, I said dare to lie, is they have concerns about their positions, if they will be punished by the central government. That's the only concern for them. In terms of cost, is not the issue. You can spend as much as you like to solve the problem. Because this thing is huge, not just for Wuhan or Hubei province, where the epicenter of the problem. It's also a problem, national, even international problem for China. You get the US got 600, 700 say don't come, no flights. In terms of cargo and shipping, create a whole mess globally. So it's not just the Chinese issue, it's a global issue. China has to improve the situation there immediately without any doubt. So from a top to bottom, there is no reason to hide, say anybody has any doubt about us. If anybody has any doubt, we're done. China say we're gone for the whole year.
Yeah, I completely agree with you. That's the analysis I've been carrying out from the beginning. So I'm not going to question this analysis of yours because
no, it's
too logical. Any tentative now, a month and a half, 2 months almost later, to cover up or misreport would provoke disastrous consequences for the whole of China and for its
They will question that. They will question that.
Right. So if, on the other hand, so how comes, given that I tend to agree, and the facts that I've been told by other friends and by sources of information coincide with that, this gives us a situation which is very bipolar, right? And so we may want to try to assess that. Why bipolar? Because out of 17,000 cases registered in mainland China, about 11,000, a little bit more than 11,000 are reported in Hubei province.
Yes.
Now, these, we agree, may be an underestimate. They may easily be twice as many, 3 times, 4 times, we don't know. On the other end, the other 6,000 roughly, you seem to suggest that, as far as you know, those are real cases. Those are a correct estimate of how much the disease has spread in the other provinces of China.
Yeah.
Well, this one, and the mortality rate there is very low.
Mm-hmm.
It's about, in fact, 20 times smaller than Hubei province, right? We have essentially 11 dead people reported in the whole of China outside Hubei, out of 6,000 infected. So if that's the case, this suggests that the way in which the virus spread was very asymmetric. For some reason, the people that got infected at the beginning, the Hunan market, did not travel outside Wuhan or Hubei province for the Spring Festival, right? Otherwise, we would have many more cases around China.
Yes, right. So let me explain that.
Right.
I think the death related to coronavirus in Wuhan is underreported, for sure. That leads to the lower fatality rate for Wuhan, for sure, no doubt about it. Because one particular reason, many people died because of the coronavirus. They were not recorded as the case it is. Why? Because they never got the test, never been tested, whether or not they were affected by the coronavirus. So when they die, and China has a tradition not to do the autopsy afterwards. You die, you die. And the doctors say, hey, based on what we know, you got a lung problem. So it's a lung problem. It's not recorded as a corona case because it's not tested. So they don't know whether or not it's a real case. So they simply say, it's not to be, for whatever reason, they record it as a lung problem. It's not a coronavirus. So that covered lots of deaths, which are not reported as a case related to coronavirus. That tells you why the fatality rate in Wuhan is underreported. Can I explain that? Did I explain that well enough?
No, that's quite clear. But what I'm saying is, and unfortunately, so I'm trying to get in touch with colleagues and friends in Wuhan and Wuhan Hospital to get a better assessment. I hope to be able to.
I hope you will get enough information from them.
Yeah, to get information by tomorrow or the day after. But on the other hand, so let's focus on the rest of the country. Mm-hmm. What are the current, during your trip, what were the current measures to limit the spread of the disease to the rest of the country?
How they're limited?
Yeah.
How they're trying to control?
Yeah.
Let me tell you. I would say probably that's a maximum control China can impose on Chinese now. For example, at the very beginning, it did not seem to be a big issue, right? The news report, they started like early January, they started to say something is going on in Wuhan. And we did not pay attention to that because it wasn't reported as serious as it is now. Until the date, I think I realized a little bit on the trend from Beijing to Nanjing, which was on January 14th afternoon. At the Beijing airport, nothing. You did not see people put a mask on themselves. I didn't wear any masks. That's 14th. And on the
January 14th?
Yes.
I see. So this is quite surprising because we knew, I mean, I left, you may know that I was actually in Wuhan at the beginning of December and I left Beijing.
No.
Yeah, but
really?
I'm fine. Okay. I got tested. I'm fine. I left China in December 19, but here in Europe, and I was actually in the United States at the beginning of January, we got news of the virus infection around January 6, 7, 8, some number like that. I don't remember. Exactly.
I did not, because at that time I did not pay attention to that thing because I was in Beijing, in Tsinghua University on campus. I was working on a couple of projects with my colleagues there. So I did not, nobody was talking about it. I did not have time to read the news or watch the TV even. So I just focused on my thing. And then went to Changchun, nothing. I went to Shenyang, nothing. Nobody ever wear any mask on the streets. We went to banquets, fine. At that time, I think it did not reach the level as it's supposed to be. Let's make that way. And the rest of China, since we're going to have Spring Festival soon, everyone was preparing, wrapped up, get ready for Spring Festival, celebrate for the festival mode. So even on the train, in the middle of the train, knows there's someone in front of me, put a mask. You know, he was like 30 or 40, so seemed to be healthy. He was not sick. Next to him was probably his wife or family member, and she did not wear a mask. He was the only one wearing a mask in the whole train. So we did not raise any alarm to me. And when I got off in Nanjing, it was fine. Nobody else was wearing a mask. A friend of mine picked him up. I went to a hotel. The rest of the 2 days, nothing. I went to Shenzhen for the next week, nothing. I came back to Hangzhou on 19.
January 19.
Yeah.
Nothing. So you're telling me that, in fact, while in the West, everybody was talking about it, in mainland China, news agencies didn't report about this until that late?
I wouldn't say did not report. Probably I did not pay attention to that. But on the 21st evening, I was in Hangzhou, was having dinner with my friend there. And suddenly, my cousin texted me. And he'd say, hey, brother, something you need to be careful. What? And it's reported that Hangzhou got the case affected by coronavirus. What? Coronavirus? Ooh, right in the city, in Hangzhou. So you need to be careful. Oh, okay, I will be careful. Because my friends, they stayed in Hangzhou. Nobody went to Hangzhou. Nobody came from Hangzhou. It's okay, don't worry. I will leave next morning. Because I plan to leave for the next morning. Anyway, 22nd. That's about 2 days before the Chinese New Year. So I left Hangzhou and I took the train. And because the funny thing, I booked the wrong train. So it already left like 2 days ago. So I have to book another train. Hey, I got it. It was not super crowded. Of course, I paid more money simply to get a business couch. So I paid a little more money with few people in the couch. And then got to Nanjing, still calm. That was on 22nd. And I was having lunch with my friends. I didn't see people wearing masks in Nanjing. Only when I got home, boom, the government announced we're going to lock down Wuhan.
Right. Because that's the same day they locked down the Wuhan.
Yeah, that's the day they locked down the Wuhan. The lady, boom, everyone, oh, wow, gosh, we need to work. So that was the 22nd. Yeah, 23rd. On the 23rd, I went to Yangzhou, which is my hometown is in Taizhou. Taizhou is the city about 2 hours if you drive from Shanghai on the north bank of Yangtze River. It's about 1 hour to the east of Nanjing. It's right in the middle. Here's Shanghai, here's Nanjing. Taizhou is here, here's Yangtze River. So it's right in the middle. So I went home, and then I went to my mother parents-law's hometown is Yangzhou. Yangzhou is about half hour west of Taizhou, or 1 hour away from Nanjing. So they're next to each other. I went to Yangzhou to visit. It's on, no, I said 23rd. That's 23rd. Okay. So when there, there's still not so many things
so
there.
You're describing an extremely different picture from the one we got here. You're essentially saying that in spite of the fact that externally the authorities in China had admitted of the virus and of its seriousness early on, and in fact the virus had been isolated by Chinese medical researchers as early as January 9 or 10.
Yeah.
I forgot the day, I think January 9.
Yeah, around that.
It took about another 10, 11 days, 12 days for
Wasted.
the government to, so the
React.
wasted time was much longer than I thought. I thought the wasted time went all the way from middle December to end of December, but that after that, there was a reaction and people in China got informed. Instead, people in China got informed about this later than people in the West got informed.
I don't know whether or not they're informed or they get the information from some private channels.
Sure.
Because,
then, you know, people that use VPN and reads
that's right.
foreign
They
sources,
get
whatever.
the information out. They probably in China, I would say, probably people know on the ground in Wuhan, they know how serious the problem was.
Yeah, but no doubt that in Wuhan they knew. I mean, it was.
They knew it. They knew it. They passed according to some official protocol, they pass the information layer by layer up to the center. And then let the Chinese CDC to make the final decision whether or not it's a real case. Because according to the Chinese law, local CDC or hospital, local government does not have the authority to make an announcement, this is a public health emergency. The power belongs to the central CDC, the central, whatever they call it.
Okay, well, that's quite interesting. So there is a responsibility. I don't want to push too much into politics.
No, it's okay. Don't worry. I'll be honest.
There is a serious responsibility of the central government. So they not only reinforces what Wuhan mayor and others have said, look, we informed you. You took a gigantic amount of time to feedback, respond, and authorize us to go, you know, on serious.
Actually, there was a report written. There was an article written by a Chinese economist. He's happened to be in the public health area, so he wrote from a legal perspective who the responsibility is. But of course, his article was focusing on the local government's misdoing. So they said even though local government officials were not authorized by the central government to make the announcement, but in that law, it does give you a way, say, if you do it, you will not be punished in any way if you make a mistake in this case. If you make it, this is not a mistake. If they make an announcement, hey, this is a public health emergency, they make it. Eventually, if it's false, they won't be punished simply because they have good intention to protect the people, period. So the problem now, you can see, on the one hand, the central government mishandled it. I would say central CDC mishandled it. They took too long to react to this situation, one. Second, the local government should not wait until the central government tell them, so hey, it's a public, they should have made that, because they know 14 nurses were affected anyway. They know already it's a people-to-people transmission, so there is no reason it's a public health emergency. They did not do it simply because what? They don't want to take the responsibility. They think if they make the announcement, they violated the rules, violated the law, because you don't have the authority. But they did not understand they do have the duty, have the responsibility to the public, the people who are serving. They forgot that.
So this late, extremely late reaction on both sides, and you know, I'm trying to stick to the fact. I understand there's been not a resolution, but a kind of a uncalled opinion, an unrequested opinion of the Chinese Supreme Court saying the doctors that had been initially punished and persecuted by the Wuhan police.
No, they're released.
Right, they've been released and free, and they said they did their duty.
They're praised.
So, excuse me?
They're praised now by the media.
Yeah, now they're praised, but they run a huge risk, which, I mean, the logical consequences for you and me are obvious, right? This suggests that a certain administrative and political system where everything is controlled by the top creates layers and layers of irresponsibility, and people just
exactly
prefer to be inactive and
they
take no decision.
Just relegate the authority responsibility to the top until to the very top.
Exactly. That's exactly. So it's quite remarkable then, and this may explain why there's been such a gigantic delay in the city of Wuhan to provide them with medical support and test kits and so on, right?
They did not ask for it because it was not announced as a public health, so the whole system was not initiated, the protocol.
Yeah, but in Beijing, somebody knew. They had reports for a month that there was a situation in Wuhan. This is quite remarkable, right? Dedicate
the CDC, the central CDC, they knew.
Right.
They did not act quickly enough to push the button because they're concerned if you make the wrong thing.
I understand. So, but let me now go back to the practical matter here. So, if that's the case, which means there was a delay that lasted 20 days longer than we would have thought, the more surprising that there are so few cases around China, because you know, between around January 15, 14, 12, 16, lots of people traveled.
Yeah, around that
from Wuhan to other parts of China.
Yeah.
And now, you know, we are about 2 weeks after that.
Yeah.
Which is way past the incubation period. But
no, it's gone.
Evidence says incubation period is at most 14 days, but most likely around 10. And so we should have had an explosion of cases around China, and we don't seem to have. So
we didn't.
How do we explain? People from Wuhan don't go celebrate Spring Festival, or let me try one other hypothesis. Maybe because of the way the virus originated in the Hunan market, which is a market where typical users are poor people, and maybe poor people don't travel, and maybe this is, while it is very dramatic in Wuhan, it's also affecting the poorest people in the area.
Could it be? Could it be? Let me put it to this. You just raised a very interesting point. According to the Chinese side estimate, 5 million people move out of Wuhan before the announcement. Lockdown.
5 million?
5 million. It's an official report. 5 million people. They have maps. They have destination where they according to the big data, the tickets they purchased. 5 million. On the same day, the late night when the Chinese government say we're going to lock down Wuhan, about 300,000 people move out of the city before it actually implement 10 o'clock in the morning or 9 o'clock in the morning. So they made an announcement in the early morning, like night, like 3 or 2 o'clock. They did not implement immediately. So about 200,000 people move out of the city within 5 or 6, 7 hours. So think about that.
Right.
So 5 million who were moving out of the city earlier? Who? Most people, I would say, those 5 million people, they're just regular business people.
Yeah.
Because most of the lower end labor, they will stay until the last few days, for sure, because they want to make extra money. And then the business owner will ask them to stay until like 1 week or 5 days before the Spring Festival, you go home. That's, you start the official 7-day or 10-day holiday, right? And those 5 million people, most often they take bullet trains. They fly away out of Wuhan. So those people, most often they're high or middle high income. They can afford it. They can leave early. They make a deal with the employer, say, I'm going to leave. Or some business people. They own a business in Wuhan. They decide to stop the operation earlier and then leave the Wuhan. So those people are the income is relatively high. The social status is high. The education level should be really high relative to the later group who choose to stay in Wuhan and leave Wuhan later. So you see the timeline.
So there is an interesting social aspect to this, partly because of the origin of how the virus originated and spread into humans, and partly because of the political choices and need to work, basically, and decision to travel. We have a very polarized thing. There is a subset of the people in Hubei and Wuhan very heavily affected by this, and might be the poorest among them. And for a complicated series of circumstances, the rest of the country may be just panicking, but not really being affected by the virus.
That's right. That's a right estimate. Because those people, you think about those people in the early group who left Wuhan, they enjoyed their life. They went to their hometown, say, hey, I'm home. Maybe have a party, not there yet, just small party, because the real holiday season is not there yet. There may be small gathering. I chat with the friends, those kind of things, close friends, have a drink, a banquet, something, celebrate, I'm back anyway, right? So that one, most often those people have their private cars. They have private vehicles. They don't take the buses or trains to move around city.
Right, so
that will reduce
less infective and less infectable.
That's right. They won't spread as much as people who came later, who did not have cars, who rely on public transportation. Does that make sense? Yes, I think so.
No, that seems to me making a lot of sense. And so it's actually, there are a variety of considerations here, but let's keep brief so our listener knows. But so, for example, first of all, it shows that the internet wall works very well. People like you and me, we are used to use VPN, and we essentially ignore, when we are in mainland China, the existence of the internet wall. But we are exception.
We are exception, but how exceptional we are? That's the question I'm asking.
Well, this evidence suggests, you say on the 19th of January, when all the West talked about this, you were traveling around many big cities of China, and people seem to ignore the risk.
You know what? Right. I wouldn't say it's because of the information control. I wouldn't. Because no, because right now, you know what? As long as you want to get access to foreign information, you can. If you want, you can.
I know, but apparently people don't care or don't do
exactly
whatever it is.
Yeah, that's the case. Because let me be honest with you, all my friends, they have VPN on their cell phones, on their computers.
Oh, no, I know, my friends too.
Yeah, but the problem is, the issue is they don't use it so often. They only have some big news come out. Oh yeah, we need to get out of China. We flip over the wall to look at what's in the other side. Most of the time, they're busy with money making their own life, right? So they don't really, like America here in the United States. How many people know what's going on in Europe? Nobody cares.
Yeah.
It's a self-centered society. We become so individualized, self-focused. We only focus on the nearby society. We never care about what's going on global-wise. Only, some bomb, some airplane dropped. Somebody killed somebody, big names, right? Only when somebody got elected, some idiot got elected. Some smart guy got killed, right? Only those big news, those being global news, you don't use it. You don't need to get those news through VPN. Everyone knows it. China report, American report, European report, so nobody cares about the daily life of regular people. With those minor issues, who cares? Ebola. If it's not break out, if it did not transmit to the large scale, affect American, European, who cares? Nobody cares. Chinese, same thing.
Yeah, Chinese, same thing. So, okay, listen, Yifei, this is very
Yeah.
interesting, and I thank you for this. If you don't mind, we may want to reconnect in, say, a week or so and get an
Sure.
update
Yeah.
of
Don't
what we've
worry.
been conjecturing tonight, and let our listener know more.
No, don't worry. Yeah,
All right.
that's fine.
Thanks a lot.
Oh,
Thanks a lot.
we talked about like 30 minutes or something like that, I think.
Oh yeah,
Oh, 1 hour.
we
Oh gosh.
no,
I got
well,
an eye problem.
we're being 1 hour on, but at the
Yeah, yeah,
beginning
yeah.
the connection was
We
not
got
working. I
got
think
the computer. Next time we won't have that problem. We'll already know how to mess up
now
with
we'll become
with the
expert.
computer. Yeah.
All right,
Good. Thank
sir.
you.
Thanks a
Yeah.
lot. Very kind. Very
Nice
kind.
talking to you. I
Nice
hope
talking to you.
I answered some of the questions to your satisfaction.
I think this was very useful. Very, very, very
Okay,
useful.
good. I hope it helps the audience too, and to
Yep.
understand what's going on in China. And
Yep.
from somebody who grew up in China, who loved China and who loves America. I love both sides because I've been here for 25 years. My 50 years, half was spent in China, half here, half. You cannot tell me I'm Chinese. Yes, I'm Chinese American too. Americanized Chinese.
I already passed the half. I spent more in the
Oh, so
United
okay.
States.
So we talk whatever. So we can talk anything about it. It's off record. So it's a mixed thing, right?
Thank you.
Thank you very much.